Hi, I'm Lisa, and I am with the SHARE project here in Haywood County. SHARE stands for Spreading Hope and Awareness and Removing the Epidemic Stigma. And we've been doing a series of interviews that have been highlighting each of those words: spreading hope, spreading awareness, removing the stigma. And today's interview is going to focus on two of those words. I think it's going to focus on spreading awareness, because this is a resource that's in Haywood County. And it's also, of course, as always, all of these interviews, we are just having a conversation about addiction and substance use, some causes and things like that. So we are doing our part in removing the stigma. Anytime we can talk about it and have a conversation about it does a little bit more in removing the stigma. And so that is one of our main goals, is removing the stigma. So today I have Patti Tiberi with me. She is with Mountain Projects, and she is the prevention coordinator. A couple of weeks ago, I had Libby Ray on, and they work together. Patti's focus is a little bit different. Her focus and expertise, if you will, is on trauma, resilience, early childhood experiences, adverse early childhood experiences, and unresolved trauma, and the role that can play in a young adult, older adult turning to substances and addiction, if you will. So we're going to talk about that topic today. I'm going to let Patti introduce herself a little bit, tell us where you're from, what your educational background is, if you've got a little bit of a story as far as it relates to this being something that's a passion for you. So take it away.
Well, thanks for having me.
Yes,
first off, Lisa.
absolutely.
It's great to be here. I will say that I have a little bit of a cold, so sorry if I'm a little foggy. But so I have been was born and raised in Western Pennsylvania.
Okay.
Part of the Appalachian chain, so I got that Appalachian culture. And like Libby, I claim roots here, since the town of Brevard is named after one of my ancestors. So. And our southern family was over in Iredell County. And my background is that I've worked in addictions. I got a master's in counseling psychology, and I've worked in addiction treatment for probably 25 years or so.
Okay.
And I kind of tongue-in-cheek say that I came to the dark side and moved towards substance misuse prevention. And part of that was because I've worked the gamut. I've worked inpatient, I've worked outpatient, I did private practice for a while. I did a lot of DWI work in my career. So I did work with domestic violence, batterers. So I saw, particularly in my private practice, that one of the populations that I worked best with were people that have been through a lot of trauma.
Okay.
And that's a blessing and a curse, in that you hear a lot of really difficult stories as a therapist, and also to know the tragedy of some of the things people have lived through.
Yes.
And I, as I talk to groups now, one of the things I talk about is when I first got in this field, and I'm older, so it was in the last century. I learned early on in addicted families, we have those three rules: the don't talk, don't trust, don't feel. And this is really for high-risk families.
Okay.
So whether it's domestic violence, whether it's a difficult divorce, whether it's mental health issues, addiction, that we don't talk about what's going on in the house. And this is primarily looking, at that point I was doing some prevention with kids, of looking at the impact on kids, is that you don't go out and air your dirty laundry.
Yeah.
You don't really trust people outside your house. It's questionable whether you trust people inside your house. And you do everything you can to not feel, because it's too overwhelming. And one of the things that I recognize, particularly as I've transitioned into doing more work with trauma and resilience, is as communities, we got to bust those rules.
Yeah.
We got to start doing what you're doing now, speaking out in the community, acknowledging, because there's very few of us that have lived our lives and not been impacted by something that's been traumatic for
Yes.
us.
Yeah.
And I've learned a lot more about, I mean, when I was in grad school, this is part of what I talk about in our Drugs and Our Midst is, you know, I learned that your brain was fully developed by the time you were 12. I mean, that was a long time ago.
Yeah.
But now we know you're in your mid-20s before that.
Yes.
And what happens in that, excuse me, that adolescent brain, because having worked with youth who were addicted, they can be, because they are changing, their body chemistry is changing so quickly, it actually makes them more susceptible to that part of the brain, that reward and punishment cycle that we have, of that getting seduced over into a full-blown addiction.
Yes.
I've long been an advocate for us starting to diagnose teenagers when they have substance use disorders and potentially have a dependence.
Yeah.
Because we as the United States are terrible about waiting until, you know, a child may go into the court system because they've committed a crime, but do they get tested? Do they get, and I don't, because we kind of have this thing of we don't want to ruin their future. But when we let it go on until they're 40 and coming into rehab, they have 25 years
that they have wasted.
Of traumatic things that have happened.
Yeah.
That now they're trying to get sober, and chances are good they have kids that were their age they were, and emotionally we stop growing when we get into that dependence. Yeah. You know, our emotional development gets limited, and that's because we're putting a substance in our body that's changing the way our brain functions.
Yes.
So I do, as I shared with you earlier, I am a person in long-term recovery. I kind of accidentally fell into that, and thank God for the miracles I've had in my life. But knowing what we know now about the impact of substances on the brain, the longer we can delay, the better the chance that a person's not going to get addicted.
Right. The longer we can delay using that first drug.
Yes.
Okay.
Now, opiates have upped the ante because they are so much more powerful that you find people that you never would have seen with substance use disorders now becoming dependent.
Yes.
Just because. I really want to communicate that part of what we need to recognize is in our communities that drugs are a business.
Yes, they are.
Whether they're from a pharmaceutical company or whether they're from the dope dealer in the corner. And until we make our communities stronger and we build back I don't know if you remember growing up, but you know, everybody in my neighborhood knew where I was all the time. Yeah. And if I did anything wrong, my parents would know before
you got home.
And so we don't have that anymore. We don't have those communities taking care of each other.
Yes, and that care about each other.
Yeah.
You know, you keep to yourself, take care of your own, and that's about it.
Yeah. And we've gotten so busy. I mean, part of this is grand that we can do this, but also part of our lifestyle is sped up so much that we're
don't have time.
So busy. And we've forgotten to come back and make sure. And when we talk about resilience for adults or children, the number one factor is a loving, trusting relationship. That changed everybody's life. Yeah. Having that.
Yeah. So let me back you up just a little bit.
Okay.
How do you define trauma yourself? For me, you know, back when I first started kind of educating myself on the topic of substance use, addiction, those types of things, trauma kind of came on my radar, and I always define trauma as like trauma, like a house fire or some major catastrophe happening in your life, in your childhood. Yeah. And I was schooled in that and realized that is not truly the definition of trauma, unresolved trauma. So how do you define trauma?
Well, we have many different types. I mean, little t, big T. Some people prefer to look at it as adversity, but I want to describe it or define it based on what happens inside our bodies.
Okay, please do.
So if you and I are out, and or I'll share an example of a training that I was just in talking about. The two children are in the house when parent comes home impaired and loses control and starts yelling, screaming, throwing things like that. Kids run out of the house. One child runs down to grandma's house, to a safe place. The other child is hiding in the bushes outside the house. What happens when my nervous system, see, there's a part of our brain, and I'm going to explain this this is like a little model of our brain.
Okay.
That there's an area here that's called the brainstem. So that's like right at the top of your skull. That you don't have to think about breathing, you don't have to think about your heart rate or blinking or any of that stuff.
Yes.
That's all brainstem. And then we move up into our palm, and this is our emotional brain. So it's where all our memories are stored, it's where we learn to figure out what feelings are and things like that. And if I roll my thumb over, there's an area deep, deep inside your brain. And then when I'm teaching kids, I always talk about it as a caveman, cavewoman brain. Because it's part of the reptilian brain of it. There's a section that's called the amygdala. And it's the equivalent of the smoke detector in your house.
Okay.
It's always looking for safety and always looking for danger.
Yes.
So the amygdala hears that loud voice, boom, it goes off. So I'm going to tell you more about that in a minute, because over top of that, and that's that part right here, and this is the last part of our brain to develop. That's why when teenagers make these high-risk decisions, even in their 20s, that's because that section of the brain, but that has our decision-making and our value system, of weighing the pros and cons, what we call executive functions. So when the amygdala gets triggered, because this is about survival. This is trying to figure out
fight or flight.
Fight or flight.
Yes.
We also know that we freeze, we submit, and we can collapse. So when we talk about the amygdala saying danger, 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 what happens is our nervous system kicks into high gear, because if my life is being threatened, I want to be able to get out and get safe. So I'm either going to fight with you, or I'm going to. So, I mean, every organ in our body is impacted.
Yes.
My heart's beating faster, blood is flowing faster. And
Primarily
go into our limbs so we can move and get all that kind of stuff. Now, that little child that runs out and runs to grandma's, they know the danger, 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 so they run.
Yes.
They go down to grandma's house. And when they get to grandma's and they get that big hug from grandma, their executive functions reconnect.
Yes.
And then the other part of the sympathetic nervous system, it calms. I was confused, parasympathetic and sympathetic. It calms the body down. So it says the amygdala, everything's safe, we're good.
Yes.
Now, the little child who's hiding out in the bushes doesn't have that. So that little child's living like that. And that adrenal glands start pumping adrenaline, and that's what's going on. That's what's going on. So that kid is really trying to focus on what they need to do to be safe. Now, if they never encounter an adult or someone that cares about them, they don't know what it's like to do that.
Yes. And that's then what ends up being that unresolved trauma in adulthood.
Yep.
Yes. So then...
It's also why you can see differences in children in a family, because one child may have had some support somewhere.
And that's kind of what I learned as well, that, something as simple as divorce, and I hate to say that simple because it's not, but let's say an amicable divorce, where there is children involved. One child looks at it completely different than the other, and then one maybe, like you said, is okay, comforted, but then one has looked at that divorce in a completely different way based on personality, the way they handle things, you know, are they a more sensitive child, that kind of thing. And so all of a sudden their look at that divorce is completely than this one over here, and they have carried that on over into adulthood. So, you know, it's not quite the same as a, you know, tragic thing happening, like, you know, where you gotta run, but yet they have looked at it completely different.
Well,
Which ends up being unresolved trauma and carried over into their adulthood.
one of the things that the health department did when they did their last community health assessment was they worked and the questions they put out, they included the adverse childhood experience scale as a part of the
Yes,
question.
and I do want to talk about that a little bit.
So,
Tell me a little more what that is.
Okay, the the adverse childhood experience scale was developed by Dr. Robert Ananda and Dr. Vincent Folletti. And one was interested, Dr. Folletti was running in California a bariatric clinic. And he found that as people were getting better and losing weight and following the program, that they would drop out. And he didn't understand what was going on. So and he's an interesting man if you ever get a chance to watch any of his videos. So he said, so I met with those folks, and I said, instead of saying, why did you drop out? I said, what happened? And consistently what he found is, it was predominantly women, that they had reported remembering as they lost weight, remembering childhood sexual assault, and different traumatic experiences. And so he got very curious about this, and he worked for Kaiser Permanente hospital system. And then Dr. Ananda worked at the CDC, and he was trying to figure out if there was an emotional connection to disease.
Yes.
So the two of them got together and completed this study where they did over 17,000 interviews with patients, and compiled this list of 10 common questions. That involves neglect, divorce, a parent who's incarcerated, you know, those, I mean, you can Google adverse childhood experience scale and you can find it. They now have added some components to it, looking at historical trauma and also looking at the impact of the isms, the racism, the sexism, all those kinds of things. Because they recognize that does impact people. And what's important about it is it's not that it necessarily impacts people in a mental health way. Biologically, it impacts people.
Yes.
Because when if I'm someone who's been impacted, say, by historical trauma, and, you know, and I think about all the Cherokee brothers and sisters that live in the vicinity, and that I'm starting like this, because that has, as you will find, young people that have grown up in a lot of trauma and with a lot of oppression frequently grow up living like this. This part does not work well. The more trauma I have, the more probability I will be living this way. So we now see, Haywood County, emotional abuse was the #1 response. For people who have been impacted by ACEs. But we now see young people in kindergarten getting kicked out because they're out of control. You know, because if as an infant, I haven't had an ability to connect to you, to bond, attach to you as a parent. I'm not attached to anything. You know,
and don't know how to, really. I've never been taught that.
So, enter drugs.
Yes, please, enter drugs,
Nicotine, whether it's alcohol, whether it's marijuana, any other substance. When I put that substance in my body, it's going to go into my brain, and it's going to affect the way that I feel and the response of my nervous system. For a lot of people, it's the first sign of relief that they've had.
Does it actually close that part then, if you will?
For some,
to some extent, would you say?
I would say for some, they begin to feel like they can connect. I think about, you know, like marijuana is becoming a bigger issue. because nicotine kind of ramps you up. Alcohol for young people ramp you up more, but the marijuana tends to calm you down. The THC, which is the active ingredient, tends to calm people down, and so I'm seeing many more youth they've gotten the message about cigarettes, but now we have the vaping issue.
Yeah.
So it's for some people it's like I don't want to say that it allows their nervous system to relax.
Yes.
So they can feel a little more.
So it mimics that in a way. Would you say it kind of mimics that?
I wouldn't say. I would be concerned about saying that because in an executive function, you're thinking about somebody who can think logically and rationally.
Right.
Like even me with a cold, I can recognize sometimes it doesn't come out the way I mean it to.
Yeah.
But if I'm high, I'm not going to have that awareness.
Yeah. Okay.
So it can calm things down some,
Yeah.
but I wouldn't say the executive function is great.
Yeah. Okay. Got it.
Yeah.
Got it. So let's round a corner then and talk about resilience. Okay. Well, how do you define resilience? And then we're kind of put them together.
Okay. So resilience is one's ability to cope with a situation in a manner that helps them to come back and reset their balance. We talk about a resilient zone.
Okay.
And when I'm talking to kids, I'm kind of talking like with thinking about athletes when they're performing and it's like they seem untouchable. Their energy's high, they can come and go, but they're doing really great. You and I have that.
Mm-hmm.
We get in our rhythm and it's like, oh my gosh, it's already 3 o'clock. How did that happen?
Yep.
That means we're in our zone.
Mm-hmm.
The
Okay.
energy in our body that's being produced by our nervous system is ebbing and flowing.
Right.
As it should. Now, I frequently share an example of Monday morning I come into work and open my email and the whole screen fills up with all these emails.
Yes.
And there's all these, I had my little list of what I was going to do that day. But here's all this stuff. I can feel myself go, psh, I'm never going to be able to do that stuff. Because once this gets triggered, I'm going to start hearing all that negativity. Like, I can't do this job,
Yeah.
That's just the nature. Because that fear is going to trigger a negative response in our head.
Right.
So any of those little voices, I tease and I call them the committees.
Yes.
You'll start hearing them. So actually there's a group that I worked with in Asheville, they're resources for resilience, that teach a training on tools to reset.
Mm-hmm.
So examples of resetting, when I'm flipping like this, I can do a little grounding exercise. Something as simple as just paying attention to the sounds around me, just starting to feel myself. And part of that is sensing into what my body is experiencing.
Right.
So I'm feeling if it's warm or if it's cold, if I can smell anything, and then how am I feeling inside? Am I tense anywhere? Am I warm? And if I allow myself even 30 seconds or a minute to do that.
Yeah. Well, I guess it's kind of taking you out of your head. It's taking your thoughts it's kind of a distraction in a way. It's taking you out of the voices in your head and you're actually thinking about other things.
Well, it's not only that. What we're doing, because that thing that got me to this, that started all that negativity, is that my body had a reaction to something that felt dangerous.
Yes.
So when I recognize it's my biology, it's not just the committee.
Yeah.
The committees in my head show up because something in my body. Now, we are really good at living outside of our bodies.
Mm-hmm.
We're just really good at
and
as a trainer.
I'm guilty, yeah.
But, think about the athletes or the clients that you work with, and when they overdo it because they're not paying attention to how their body is.
Yes.
You notice?
Yeah.
Yeah. So our job is how do we get back into our bodies? And we find a lot, I mean, grounding is certainly a simple way. There's many tools. You know, a lot of folks in prayer, they get back, they get reconnected with the sense of self. Meditation, mindfulness. There is a psychiatrist, a child psychiatrist named Daniel Siegel, who was one of the first physicians I heard talking about, psychiatrists, talking about using exercise in mindfulness practice rather than medicating a child.
Oh, yeah. Yeah.
To do an hour of physical activity a day. Because we got to burn that energy off.
Yeah.
You know? But realistically, the other part to talk about is two things. One, if I've had a lot of trauma in my life and I don't know how to reset,
yes,
I'm not going to live in my body because it's not a safe place. And that's a place where it's time to call somebody and get some help.
Yeah.
Because there's nothing that should stop you from getting some support for yourself.
Yeah.
And some healing. Otherwise, thinking about I think I just forgot the second thing I was going to say.
Well, maybe it'll come back to you.
Yeah, it does. It floats around and yeah.
Well, okay, so let's talk a little bit then about your definition of trauma, definition of resilience, and how that comes out then in the work you do at Mountain Projects. The programs. Do you have some programs in place where you are either educating the family members? How do you? We've defined all this. We now recognize what that looks like. How early on it can manifest itself in a youngster. What are some programs you have in place? Are working on? What is your target age, if there is one? I don't know. Is it the family members? Do you try to prevent some of those early childhood experiences so they don't then become unresolved trauma later in life? Tell me a little bit more about what that looks like as a job description, if you will. I know that's a lot, isn't it?
Yeah, and it's not an easy thing, but I do want to say you're very good at your job here.
Well, thank you.
And so I was given a behavioral health equity grant for Haywood and Jackson counties a few years ago. And that was really to look at the difference in people being able to access behavioral health services and looking at the isms of who's getting identified more.
Yes.
And so, reasonably part of what I looked at is we're predominantly white community. And but I started digging a little deeper and recognizing, we have really high poverty rates in both of those counties. And when you look at children under 5 who live in poverty, the chances of them being successful in life just bottoms out. And so when you look at Haywood County or Jackson County and look at their free and reduced lunch, how many of the young people who come? So I started looking at that, and then I brought a couple of the trainings to one to Haywood and one to Jackson and the Reconnect for Resilience. And as a spin-off of that, what we began to do, we actually have a group in Haywood called Haywood Connects, and we meet the second Monday of every month at 10 o'clock. And it really is a group who's looking at how can we better educate and develop some trauma-informed practices in Haywood County, because each of us can do things to help prevent re-traumatizing.
Yes.
So when I think about a child that's, potentially lives in domestic violence, homework's not done, concentration is horrible, they may not have had dinner, they may have slept in the same clothes, show up at school. And when they get to school, how are they going to behave? Not very well. Yeah. Because they can't, biologically, they are not in a position to be able to concentrate. They're not in a position to be able to be responsive and engaging. Yeah. Because they're
too
space.
Distracted. Yeah.
Now, if I have to take my math test, am I going to do well?
Yeah.
No. But as we look at how we as faith groups or we as schools or other groups in the community. We as a county government, how can we become more trauma informed? We begin to talk to people in a different way.
Yeah.
Rather, what's wrong with you? Of doing what Dr. Folletti did by accident. What happened?
Yeah.
And being able to recognize that some people haven't had very much opportunity. We started, I was supervising a woman named Tina Manning who was working on her master's, and she worked in our Head Start. So we partnered, she and Janet Trantham and I, looking at, is there a curriculum? Head Start federally recognizes a program called Our Journey Together, which teaches parents how to better attach to their children. And attachment being the big issue with helping to develop that resilience in children. And it's also a course to train parents in how to improve their own resilience. So they did a pilot in Haywood and they did a pilot in Jackson. And the praise for the program from both those families was out the roof. That they felt more confident, they felt better connected to their other parents. And of course, you know, if you're a Head Start parent, chances are good you've not had an easy life. And you're not living an easy life because you don't have very many resources for you. So that was a real positive thing. And
is that program still, or where does that stand then? I mean, you said it was kind of a test.
Yeah.
How long ago was that? Is it something that's going to be trying to be implemented then?
Well, that's
in
part
a broader
of
sense.
What we're talking about with Haywood Connects.
Okay.
Is having folks in the county trained in that model, and it could be like volunteers at the library. It could be, you know, any community member that's interested in learning how to do that. So that's part of the plan, and it's kind of, I've been asked to kind of wait until next spring because the woman that's the trainer is a little overloaded right now. So that's on the agenda. We're also looking, I know that several of the churches here have shown the resilience, the biology of trauma, and so we do have the movie, and we'd love to show it to people.
Okay.
I'm very open to doing.
I'd like to get more information on that from you. Yeah.
Okay. I'm very open to doing presentations in the community, talking to folks about resilience. We did a forum at Grace Church, and I think we had about 40 people, and 24 of folks took the ACE scale.
Okay.
50% of the folks who took that had a score of 4 or more.
Wow.
In their ACE scale. And 4 was a cutoff. I mean, and please know that just because you have an ACE score, that does not mean you're predestined, because any work you do in healing yourself helps mitigate the impact of that stress. Same recovery process that we use for same process we use for breast cancer, for any type of cancer, any type of heart disease. That's the thing. If there was a wish that we would get behind when people are in recovery from any illness, it's the same process, and we all need support. You know, I can go out and wave my flag, but there's a time I'm going to get tired, and God willing, there's going to be somebody that's going to be able to help me up. You know, if I fall over. But
connection. Connection.
That's exactly what it is. Connection and support.
Yeah.
And you know, the funny thing in the brain, the instinctive response when the amygdala triggers is to look for connection.
Wow.
And as I look around, if it is not there, then I go into fight, flight.
Yes. Yeah, interesting.
Yeah. So,
wow. Well, all sorts of stuff in here. All sorts of good stuff in here. Yes. So, you mentioned a little bit. Are there Haywood Connects? Are there other people that you go to? Like if you run across someone that is struggling, or a family that do you have some resources that you can kind of plug them into? Do you refer them? I'm using the word referral loosely as far as but. Try here, try this resource. What would be some of that circle of
connection
your,
for them?
So
Perfect. First off, I know that Libby shared this, but the Mountain Strong WNC.
Yes.
And if you go to the Mountain Strong tab, we have a page specific for resilience.
Yes. I'm
Um,
familiar.
so to check that out,
Mm-hmm.
because the important part, and part of why I drill home so much on resilience, as we think about stigma, is when I recognize this is a biological thing, this is not something I chose, and I'm responding based on what my brain is able to do in the moment,
Mm-hmm.
the shame goes away.
Yes. Which is a part of the definition of
Huge.
stigma.
Huge. So
Mm-hmm.
in recognizing that as well, I think that we begin to see our own humanity.
Yeah.
So I can begin to see your journey
Mm-hmm.
and your struggles, and we can share those in
Yes.
common, and we can figure out how to help support each other.
Yeah.
And I think that's when people see that resilience movie, that's what I see.
Yeah.
Is that they get it. This isn't about me being a failure. This isn't about me screwing up. Yes, I've made bad choices, and I've made them because that part of my brain that would have helped support that wasn't available.
Yeah. And haven't we all made bad choices?
Yeah.
So,
Yeah.
you know, there's that too.
Yeah.
You know, at some point, it may not be the choice to do a drug, but we've
Mhm.
all made bad choices at some point in our life, you know, and that's,
Yeah.
you know.
So one of the things that was really inspiring, I went to a principals meeting down in Jackson County at the school system, and they have embraced that, and they've gotten the trauma and resilience, and they've gotten a lot of their staff trained in that trauma and resilience
Awesome.
model, that resources for resilience. So one of the principals at the meeting said, "I love the resilience." Well, they all did. They all talked about how much they appreciated
Mm-hmm.
staff having gone through that. And the one principal looked at me and she said, had a little third grader come into my office the other day, said, "I'm right here, and I thought I should come talk to you before I flip my lid."
Wow.
If we can teach our children,
Yes, to recognize
start-
that.
what we're teaching them to do is take ownership of their health, whether it's their mental health, their
Mhm.
spirit health, their physical health, and which means that we're probably preventing someone becoming mentally ill or
Yes.
drug dependent.
Yes.
Yes.
Yeah.
And the
That's
part,
very powerful. Yeah.
the part about the 4 ACEs of 4 or more,
Mhm.
see, it did come back.
It did.
Yeah. Is that we see, and you will see this if you Google the ACEs study, we see significant increases in risk of disease. So certainly an increase in risk of dependence, increase in
Yes.
risk of heart disease, depression,
Yes.
Cancer,
Yes.
high blood pressure.
That was in one of the
diabetes.
videos on that on Mountain Strong on that resilience page, if I'm not mistaken.
Mhm.
There's a short little video on there. Maybe I'll put that in the link in several of the links that I attached to this
Yeah.
video. But that was the percentages, and I am not going to remember what it was right now. But the increased chance you have of developing some kind of disease
Yeah.
later on in life it was astounding.
Yeah.
I mean it increased your chances of,
Yeah.
of getting a disease by leaps and bounds.
Yeah.
Yeah.
So it also brings us to that stigma place of how come you didn't get it and I did.
Mm-hmm.
That none of our biologies are the same. And as we recognize that our biologies, that doesn't mean that you're better than I am.
No.
That doesn't mean that you're more moral, because we often categorize people with mental health and substance use disorders as some moral defect,
Mm-hmm.
which is not. It means that biologically my system responded differently than your system.
Yeah.
And if we both had that experience, you had support and I didn't.
Mm-hmm.
And that's not a good or bad.
Yeah.
That's
It's just a fact.
so part of my healing
Mhm.
journey is that I have to, number one, I have to take responsibility for my healing journey. I can't leave that off on you.
Yeah.
And no matter what the disease is, whether it's diabetes, heart disease, whatever. And it means committing myself to that journey. Frequently when I would talk about people going through substance use disorder treatment, I would use the comparison of when my mom had heart surgery. That she went into the ER for difficulty breathing.
Mm-hmm.
They admitted her to the hospital. They did catheterizations. They had her prepared to have heart surgery. She had her surgery, and all of us had to go through this little training
Mm-hmm.
about what that surgery was about and da-da-da-da-da. And they wouldn't do that until we all signed off on that.
Wow.
And then she came to intensive care,
Mm-hmm.
and she spent several days in intensive care. Then she got sent down to the regular floor. I think it was like a cardiac floor. And then it was a few weeks later, and she got, or not a few weeks, a few days later, and she got discharged.
Yes.
And in 6
Whole
weeks,
process.
she was in cardiac rehab for several months.
Yes.
What our system does with substance use disorders is I call
Mm-hmm.
because I need help. So I get evaluated, do I need to go to detox? Do I need to go to an intensive outpatient? Do I need to just come and have an assessment?
Yes.
So I get engaged, and this is across our country, this is nothing specific, but we as a country, this is what we do. Okay, so you send me to detox,
Mm-hmm.
and I get a couple days. What you've done is you've taken all the drugs out of my brain.
Mm-hmm.
None of the natural chemicals are back yet, because that takes a
Long time.
year to 18 months to get reinstated. So then I get sent home. Frequently I get sent home to wait 2 weeks to get an appointment with a therapist. This is one of the highest times
Yes.
of relapse and overdose. This is one of the most difficult times. And yes, people can go to support group programs, but we need to be able to step
Better
them
system.
down
Yeah.
the same way that my mother was stepped
The
down.
way
in that
other
cardiac.
diseases are treated.
Yeah.
Yeah, because
Yeah.
it's a disease.
Yeah.
Yes.
So that's where we need to advocate.
Yes.
Same with mental health.
Yeah, absolutely. Oh, they're so linked. They're
Yeah.
so linked with each other.
Mm-hmm.
Okay, you mentioned a little bit. I think anything else? I think most days, I think we've hit on pretty much everything I wanted to. I got one final question, which you already touched on a little bit. Anything else you want to make sure we talk about?
One thing I do want to say is to believe that a physical illness is only affecting my body is not very realistic. We have body, mind, and spirit, and we need treatment for all of those when we have a physical illness. And really, we need to advocate for our health. Doctors,
Treating the whole person.
exactly.
Mhm.
And doctors have a certain protocol that they're required to follow based on what insurance will pay for.
Mhm.
And I can't tell you how many people I know get frustrated because they get less than 15, less chance to tell their doctor what's going on.
Yeah.
But if you have experienced trauma in your life, I really encourage you to take care of yourself and allow yourself to talk to somebody. It might be
Yes.
just talking to a friend and sharing. It might be, God willing, it might be that your siblings are willing to really talk about what happened growing up. But a lot of us got that message, suck it up.
Mhm. Yeah.
And it's killing a lot of us.
Yeah.
So let's break the rules, let's talk, let's learn to feel,
Yes.
let's learn to trust,
Absolutely.
particularly trusting ourselves.
Yeah. And you will find somebody out there that's going to listen.
Yep.
You're going to. The more you talk about it, the more you're going to find somebody that'll listen.
And you're going to find a lot of brothers and sisters that will walk that path.
Absolutely.
Yeah.
Yep.
It may not have been the
That's
exact
one
same
thing I've learned. It doesn't take long, and you realize there's a whole lot more out
Yeah.
there just like you.
Yeah. So let's lift the veil and start
Yes.
speaking our truth.
Yes, absolutely.
Yeah.
Okay. Any one last message? I think that probably should just end right there because that's a great last message. But if there was one thing you could change, specifically maybe in this area, as far as it relates to treatment, the way addiction, the way, stigma, anything? Would there be anything that you would change at all? What would be one final message, or is what you said just a minute ago a good place to just end?
I remember Dr. Don Teeter, who used to practice here, one time talking, he was doing a training at a Murphy Medical Center at the time, and he said he always struggled when people would come that had substance use disorders and trying to understand it because he wasn't somebody that did. And he said, one day I asked a patient, what made you start? And she explained that she was having some struggles and, she had gotten hurt. And she was prescribed an opiate. And he said, well, what made you continue? And she said, the first time I took an opiate, I saw God. And he said, I got it. To know that, to put a substance, to put myself so at risk by putting a substance in, and I'll tell you that nicotine is even more addictive than opiates, unfortunately, and we somehow feel like that's okay to let our kids do all the vaping and stuff. Really, you're worth more.
Yeah.
And you deserve better. So take care. Take care of yourself. Talk, trust, and feel.
Yeah. Talk, trust, and feel. I like it.
Yeah.
Yes. All right. Thank you very much for your time today, Patti.
Well, thanks for
I
having me.
appreciate it.